Hello everyone, welcome to Pediatrics Notes and Presentation by Dr. Anjum Rashid. First important message for all parents that breastfeeding is the best for babies. This video is about 16 common bottle feeding or formula feeding mistakes, hazards and their solution. Now the first mistake is assuming that if your baby is crying, he must be hungry. Feeding every time the baby cries leads to overfeeding, which is a serious health issue, and crying baby can easily choke on milk. So solution to it is that soothe him a little bit, cuddle and hold in your arms, change the wet diaper, and dress him according to the environmental temperature. Now you can see in the picture that the mother is cuddling her baby and the father is changing the diaper. Okay, next mistake number 2, feeding with a wide hold nipple or enlarging the hole yourself. Too large hole can cause choking, forcing the baby to swallow fast, so he also swallow a lot of air which can cause colic. Sharp edges of the cut nipple injure the baby's lips and mouth. So nipple hole should be a size that allow milk to fall in drops. And while buying a feeding bottle, pay attention to its label and quality. Always buy the one appropriate for the age. Better to use specialized anti-colic feeding bottles. Now mistake number 3, not burping your baby every time after feeding. What is the hazard? Gas remain trapped in the tiny delicate tummy of the baby, which can result in tummy pain. So burp your baby every time after feeding and carry him in your arms, rock him gently, pat his back and wait for 2 to 3 burps. Now in the picture you can see that the mother is giving burps. Next, mistake number 4, letting your baby hold the bottle while feeding or supporting the bottle with pillows. Hazard is that baby might hold the bottle on wrong angle, which could lead to choking. So always hold the bottle for small babies while they are feeding, or make someone hold the bottle, for example older sibling or father. In this picture you can see that mother is holding the bottle while feeding her small baby. Mistake number 5, giving feed in a full reclined position. Milk can leak into your baby's ear, leading to middle ear infection. So semi-upright position is ideal for bottle feeding small babies, and upright sitting position is ideal for larger ones. In this picture you can see that mother is feeding her baby. Mistake number 6, forcing your baby to finish the entire bottle. Force feeding causes serious health and emotional problem and can lead to vomiting and abdominal pain. So if your baby is refusing to finish the whole bottle, then don't force feed. In this picture you can see a happy baby holding a milk bottle. Now mistake number 7, letting your baby to fall asleep during feeding. Baby should not fall asleep with formula remains in his mouth. This is not good for his future teeth. Habit of falling asleep with a bottle is difficult to break later. So never use the bottle to soothe the baby. And before sleep, the baby's gum should be wiped with a soft moistened swab and give the baby a pacifier instead, only if necessary. And you can see in this that the baby is sleeping quietly on father's lap. Now mistake number 8, using worn, cracked or bitten nipple for bottle feeding. Baby can choke on a torn piece of damaged nipple, and dirt and bacteria accumulate in the cracks invisible to the naked eye and can cause infections. So always replace a damaged nipple at every 3 months. Mistake number 9, licking the baby's feeding bottle to check the formula milk's temperature. Bacteria and other organisms in adult mouth have dangerous consequences in small baby. So never lick the baby's bottle. To check the temperature of milk, just squeeze a few drops of milk on your wrist. Mistake number 10, selecting formula inappropriate for your baby. Each age has different requirements, and inappropriate formula has serious health consequences. So, infant formula should be selected appropriately for baby's age. A formula label contains precise information. Okay, next mistake number 11. Incorrect ratio of milk powder to water. Too thick formula has large doses of protein and mineral components which can burden the baby digestive tract and kidney, and too thin formula result in deficiencies of necessary components of your baby's diet. So strictly adhere to the instructions on packaging and always use exact mentioned ratio of powder to water. Mistake number 12, using tap water to prepare formula feed. Tap water may be unhygienic and has serious health issue in your young baby whose immune system is not fully mature. So use fresh cooled boiled water or low mineralized mineral water to prepare the formula. Next, mistake number 13, overheating or boiling the formula milk. Overheating destroys the essential nutrients in the milk which is required for growth of the baby. So never boil or overheat the formula milk, just warm it. Next, mistake number 14, microwaving your baby's milk bottle. It has been scientifically proven that microwave destroys the essential nutrients, vitamins and minerals in the milk. So use stove to warm up the baby's milk, fill a pot with hot water and immerse the baby's milk bottle in it for about 10 minutes until it warms up. You can see the baby is taking his feed. Now mistake number 15. Saving the leftover milk in the bottle and mixing it with the next fresh feed. While feeding, bacteria from the baby's mouth gets into the milk, and if left alone, these bacteria multiply. Feeding your baby with this infected milk can trigger stomach problems. Now throw away the leftover milk of any feed and always prepare fresh formula feed for your baby. You can see the mother is giving fresh feed. Okay, mistake number 16. Incorrectly washed feeding bottles and nipples. Dried up saliva and remains of old milk are a good medium for bacterial growth and proliferation. Gastric ailments and oral thrush are common in these babies. So feeding bottles and nipples should be properly washed and boiled for 5 minutes after every feed. Have a few bottles, boil them together and keep them in a refrigerator or pan with a lid on. Now this video is made only for information and entertainment. Please don't use this video for the diagnosis or treatment of medical conditions. Thanks for watching. Please like, share, comment and subscribe to my YouTube channel for more informative health related videos.